Trained and equitably distributed health workers are the foundation for effective and sustainable health systems. Governments need to take responsibility and implement interventions to train, retain, and sustain health workers to provide access to good quality healthcare to its citizens. My name is Rohina Joshi. I'm an associate professor in the Faculty of Medicine and Global Health Lead at the School of Population Health at the University of New South Wales. I also have an appointment as a senior research fellow at the George Institute for Global Health, New Delhi, India. Our article titled Skilled Health Workforce Emigration, Its Consequences, Ethics, and Potential Solutions will appear in the Mayo Clinic Proceedings shortly. Now, in this paper, we aim to provide an overview of the issues of skilled health workforce migration and its consequences on the source as well as the host countries. Source countries are the countries where health workers originate from, and host countries are the countries that health workers migrate to, live in, and provide services to people. Now, in order to meet the universal health coverage, the world needs at least 43 million additional health workers. Now, the most acute health workforce shortages are in sub-Saharan Africa, in North Africa, South Asia, and the Middle East. According to the Organization for Economic Cooperation and Development, their data on health workforce migration shows that about 1/4 to 1/3 of all doctors in Australia, Canada, UK, and USA are international medical graduates who have trained from countries either in South Asia or Africa. Now, while free movement of people across different countries is a human right, there are pull factors from host countries, such as offering lucrative jobs, the prospect of a better lifestyle. Um, those combined with pushback factors from source countries, such as poor salaries or lack of equipment or infrastructure, promotes migration and aggravates these shortages in health workforce in low and middle income countries. Now, all of this leads to poor access to healthcare for citizens in low and middle income countries. Even in high income countries, there's a migration from rural to urban regions, and therefore, this inequitable access to healthcare. In fact, if we look at the African continent, that houses only 3% of the global health workforce while dealing with 24% of all the global burden of diseases. Now, furthermore, if we talk about the economics of it, low and middle income countries actually lose billions of dollars to emigration of health workers because these doctors train in government medical colleges and take this knowledge and provide services to people in high income countries. Now, in order to deal with this issue or address this issue of skilled health workforce migration, the WHO member states adopted a code or a policy called the WHO Global Code of Practice for International Recruitment of Health Personnel. Now, this is called the code, and it was developed in 2010. The aim of this code was to improve the understanding and provide some guidelines around ethical management of recruitment of health workers. Um, but the code is voluntary in nature and it's not legally binding. So it lacks incentives and institutional mechanisms that enable implementation of the code. In fact, an evaluation of the code demonstrates that it's not very effective. In fact, there's just one example of a country which follows the code really well, and that's Norway, which has implemented the code by increasing the resources for domestic education of their own doctors and nurses and healthcare providers. And the second thing that they have aimed to do is stop recruitment of skilled health workers from countries that are facing critical shortages. Um, so this is one example where a country has decided to do something both domestically as well as focus on countries where they don't have sufficient doctors. In fact, they have critical shortages. So in this paper, we have proposed some recommendations both for high-income countries to decrease their reliance on international medical graduates, and also there are some recommendations for low and middle-income countries to train and retain their health workers. Um, so we are evaluating the effectiveness of interventions, different bundles of interventions that are meant to help to train the health workers in country. For example, return of service schemes, as well as impact of bilateral policies. We hope that reviewing these policies and discussions with policymakers, both in high income countries as well as in low and middle income countries, will initiate some dialogue, help build advocacy for skilled health worker retention and better access to healthcare, irrespective to where people live on this globe. Thanks so much for listening.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.